Hi guys, I'm Dr. Shivika. As we know, November is the World Prematurity Awareness Month. Preterm birth, it is a significant health problem because it is associated with neonatal disability, long-term and short-term morbidity and mortality. WHO states that around 15 million babies all around the world are born every year prematurely. Now, what we need to understand is what are premature babies. They are those babies that are born before 37 completed weeks of pregnancy. There are three categories of premature babies. One is extremely preterm, that are born before 28 weeks of pregnancy, then very preterm, that are born between 28 to 32 weeks of pregnancy, and then late preterm, that are born after 32 weeks but before 37 completed weeks of pregnancy. Causes of preterm maturity are manifold, starting with the age factor. Teenage pregnancies or women who are pregnant after 35 years of age. Complication in these two types of pregnancies are very high, and many times because of these complications, pregnancies have to be terminated prematurely. Then many times pregnancy-induced hypertension, the babies have to be delivered prematurely. Sort of assisted reproduction. The chances of you having twins or triplets is going to be very high, and many times in these cases babies have to be delivered prematurely. Some other causes could be infections, uterine abnormalities, and most important factor is previous history of preterm birth. And many times it is seen that these women have got a cervical abnormality, there is incompetent cervix, and that is why many times they go into preterm labors. Also, excessive smoking, excessive drinking, use of street drugs are also probable causes of prematurity. So what are the problems that are associated with prematurity? The main problem is that the baby is not mature enough, the baby's organs are not mature enough, and the baby when is born cannot function properly. Starting with, the baby has got breathing problems because the lungs are not mature. The baby might need assistance for that. Second of all, the baby may have feeding problems. The fat content of the baby is quite low, so the baby is not able to maintain the temperature. Many times in the gut, the baby develops a condition known as necrotizing enterocolitis. In the brain, the baby develops intraventricular hemorrhages. The incidence of preterm birth in women is around 7 to 10%. So it is very difficult to pinpoint and say which women will go into preterm labor and which won't go. And handling a preterm baby requires a lot of skill and expertise. So for all the women, I would say they should choose their delivery facility very wisely, where there should be a good team, good core team that can handle all these complications of prematurity.